All right, guys, so this is the start of Unit 4. So this is skin and body membranes. We're going to cover a little bit of some introductory stuff today during today's lecture. So just introduce yourself or ourselves to the kind of four membranes that we have in the body, okay? So real quickly, just a basis of kind of function for skin and those membranes. They serve three basic primary functions. So we have lining or covering body surfaces, protecting some of those body surfaces, and then also most of them also provide some sort of lubrication or secrete a substance that would lubricate those body surfaces. Okay, they get broken. Those membranes are broken up into two basic categories. There are epithelial membranes, all right, because they're made mostly of epithelial tissue, and then there also are connective tissue membranes because they are made of connective tissue. The epithelial membranes, which we're going to go through here in just a second, are cutaneous membranes, which is the skin itself, the outer layer. Mucous membranes, so these are ones that line openings of our body to the outside, like your nose, mouth, parts of your ears, your anus, places like that. And then serous membranes, those are the ones that actually line open cavities of our body, but they are not open to the outside. So like our thoracic and abdominal cavities are lined mostly with serous membranes. And then finally, the connective tissue membrane that we'll talk about is the synovial membrane, which lines most of our freely movable joints that we have in the body. Okay. So we'll take a look at those. We'll start here with the cutaneous membrane. So the cutaneous membrane, like I said just a few minutes ago, is simply just the skin. It's one of the only dry membranes that we have because the outer layer of that skin is dead tissue cells. Okay, its basic purpose is to provide a protective boundary, and as long as it's intact, it will do that for us. It's when we have little nicks, scrapes, cuts, anything, or puncture wounds in that we leave ourselves open to infection. This tissue type is superficial epidermis, so it's keratinized stratified squamous, meaning that the tissue is dry, has a high level of a protein called keratin in it, right? And then it obviously is a multiple layer because it's stratified squamous epithelial. We have an underlying dermis then that is mostly made up of dense connective tissue. All right, so we're going to look at the skin itself kind of in the next lecture, but this is just a basis of kind of what it looks like. Okay, mucous membranes, like I was saying, they line any of the open cavities of our body. So they are made up of, so the outer layer, the surface epithelium, really depends on the site that it's in. So most of it can be either simple columnar, some of it can be pseudostratified columnar because it has that kind of cilia to it. All right. This type of tissue has an underlying loose connective tissue that's referred to as the lamina propria or propria, however you want to kind of pronounce that. All right. And that connects this layer to the underlying tissues. This one, like I was saying, is going to align all of our open cavities to the exterior. So this would be like nasal cavity, oral cavity. It would also line our trachea as well as our esophagus. It also lines the entire cavity from the opening of the mouth all the way to the anus through the digestive tract. All right. In most places, it is often adapted to do both absorption, meaning it can absorb nutrients or absorb oxygen and other gases, and it's also adapted to secrete substances. So inside of the lungs, inside of the digestive tract, will also do those. So these are the ones that will have most of those goblet cells that we talked about in the last chapter. Okay. The third membrane that we have are what are called serous membranes. So they are consisted of pretty much just simple squamous tissue. It has a little bit of some underlying areolar tissue, right? That kind of spiderwebby looking connective tissue that we talked about during last unit. This is the one that lines those cavities that are open, but they remain closed to the exterior. Okay, so these would be like the thoracic cavity here in the lungs, or the abdominal cavity here below the diaphragm. The serous layers, then, there are two of them. We'll talk about it here on the next slide, but they are separated by a fluid called serous fluid. All right. So there are two basic serous membranes. There's what's called the parietal, and the other one is called the visceral. All right. The parietal covers the outer wall of the organ, and it is mostly just directly attached to the organ itself. All right. Whereas the visceral actually lines the inner wall. All right, so it separates the organ from the actual space. A lot of times we kind of talk about the parietal and visceral looking sort of like a bag. So the organ itself is in this kind of bag. So again, the inner wall is the visceral wall that's directly attached kind of to the organ. Sorry, I think I misspoke just a few minutes ago. So this covers the outer wall. This covers the inner. So the visceral is the one directly attached to the organ. All right. And then the parietal is kind of attached or kind of loosely around the outside. The heart is probably your best example of this. And that's why they're using this kind of fist shoving down on a balloon. So there's a space in between the two cavities. One is attached directly to the lining. So that's the visceral. And then the parietal is attached or kind of loosely attached around the outside in most cases. Um, you can have what's referred to as an infection of this serous fluid on the inside. All right. And depending on where we find it, these two tissues are referred to kind of what or the organ that they're around. So there's the pleura. So there will be the parietal pleura or the visceral pleura. That's directly around the lungs. And then there's a pericardium. All right. The pericardium or parietal pericardium or visceral pericardium is the one around the heart. You can, like I said, get an infection in between those, and they would call this pleurisy or pleuritis. Right, itis meaning infection, inflammation. So you get an inflammation in between this. Right, when people have that inflammation, if you listen to them underneath the stethoscope, when they breathe, you can actually hear what sounds like saran wrap rubbing against itself, or kind of a squeaking noise when you hear it underneath there. Same thing with the heart. If they've got this kind of pericarditis, so it's an inflammation of the pericardium. You can hear a similar thing underneath a micro or a stethoscope when you listen to their heart. All right, so it could be in between beats, it could be while it's beating, and the patient themselves usually are going to have some experience quite a bit of discomfort when those two things happen. So if it's pericarditis, they're going to experience discomfort anytime their heart rate increases. And if it's pleuritis, they're going to experience anytime they're breathing. This is a pretty good thing to kind of remember here. So V is deeper in the alphabet than P. So V is directly on top of the organ. So it's the deeper layer. And the P is the kind of closer or mostly outside layer. Okay. So just kind of know the difference between those two. There's also another one that's referred to as the peritoneum. So this is the abdominal cavities membrane, right? Goes around the outside. Again, you've got a parietal peritoneum and a visceral peritoneum. So the parietal peritoneum actually lines the cavity itself, and the visceral peritoneum attaches to all the organs that are on the inside of the cavity. Okay. The last and the final of those type of connective tissue membranes that we have is the connective tissue membrane, which is the synovial membrane. Only connective tissue, just like its category sounds. And this one actually lines the capsule, or what we call the fibrous capsule, around joint tissue. So this is a pretty small example here. You can see in between the joint, there's a little bit of space. So there's some hyaline cartilage, or what they call articular cartilage, right here on both sides. And then there's a space that makes this little pocket. Okay. So that space is then filled with synovial fluid. So your knee is a pretty good example of this, your elbow, your shoulder, all of those are synovial membrane joints. They are lined like this. You can get an infection in this if you've ever heard of somebody that had to have fluid drained off their knee. Sometimes they will go in and drain that fluid out of the knee. We don't do that quite as much as what we used to, but they still will do that. The knee itself, since it has this little joint capsule, kind of an interesting little side note, is that when somebody tears their ACL and they don't tear this capsule, they'll actually just get swelling inside of the capsule. And there's a way, especially there's a technique that we use in the athletic training room to tell if we have internal swelling of the joint or external swelling of the joint. So you can actually tell that fluid. Most often, especially when somebody tears their ACL, they'll also tear this capsule. So the fluid leaks out of the joint, and then you get this kind of ballooning effect of the joint itself. Okay. Real quickly, integumentary system itself is comprised of a couple different things. So the skin, obviously, it's cutaneous membranes that we just got done talking about. And then there are several skin derivatives. So there are sweat glands, oil glands, hair, and nails. Okay. Basic protections or basic functions of all skin. All right. It's mostly there to really protect those deeper layers of tissue. So we're protecting against a couple different things: mechanical damage, so bumps and scrapes; chemical damage, just from things like acids and bases that we could come in contact with; bacterial damage; thermal damage from heat as well as cold. All right. Ultraviolet radiation. All right. As long as our cutaneous membranes are pretty well intact, we can protect ourselves to an extent. Okay. And then disassociation, which is simply, or sorry, dissation, which is simply just dryness. All right. The main reason that outer layer of skin of ours is dead is it actually provides a waterproofing barrier, not only from the outside but also from the inside. You've probably noticed standing in the shower for the first few minutes, water will actually bead up and roll kind of off your skin, similar to the way that it does on like a car. All right, we wax the outside of a car to kind of protect it. Well, that same thing is happening with the outer layer of our skin, if as long as it's intact. Okay. Other functions of the skin is it's going to help us aid in heat regulation, because there's lots and lots of little blood vessels right here near the surface of the skin. All right. So if we get really hot, a lot of times we'll get we'll get kind of a flushed appearance, so our skin will appear red, because we're trying to look for or trying to get rid of some of that heat through blood. All right. And then when we're cold, we'll actually get this vasoconstriction. So our skin will sometimes appear to be kind of bluish or cyanotic, what they refer to as, because now we don't have as much blood flow in there. Okay. It also aids in a little bit of excretion of some of our waste, so you can get rid of some urea and uric acid through skin, but not near as much as what you would think you do. All right, and then it also helps us synthesize vitamin D. Lighter skins actually do that better than darker shades of skin. All right, that's actually one of the genetic um, abnormalities or genetic reasons when we start to look at that, because the lighter shades of skin don't show up until we get further away from the equator. All right, and because of those lighter shades of skin, they tend to produce they allow them to produce vitamin D with less sunlight. Okay. All right, we're going to go ahead and stop there. Big things out of this lecture: make sure you take a look at the layers themselves, know the difference between the different types of layers, know the difference between the visceral and parietal pleura, and then know some of the functions here for this lecture. Okay.